We get many people who come in who are interested in fibromyalgia or fibromyalgia help. I think of fibromyalgia as more of a syndrome. It's a constellation of many symptoms. People who come to me mostly are having problems with aching, pain, typically in the upper shoulders, around the neck, top of the shoulders, just above the elbow, coming down to the sides of the trunk, the hips, and lower legs near the knees. This is sometimes can be relentless, sometimes it comes in waves, but the myalgia or the fibromyalgia they talk about, it seems to almost be from the muscle, is one of the main causes of people's with having fibromyalgia. They also is linked with chronic fatigue syndrome. And chronic fatigue and fibromyalgia, most of the times these people are just, they're sick and tired of being sick and tired. I mean, they just don't have any energy. Many things could be causing that. Most of the time, and using a applied muscle testing called kinesiology, we look at the adrenal glands. Adrenal glands are pyramid-shaped organs on top of the kidneys, and they help to make adrenaline, epinephrine, and norepinephrine. But they also help to make cortisol, aldosterone, and all the sex hormones. But that, and it helps to make DHA. When your body gets in stress like you have with fibromyalgia, it needs an increase in cortisol because that raises blood sugar. So that's one of the things that I look at when I'm looking at a total package for trying to help a fibromyalgia patient. One of the things I do for the discomfort is magnesium malate. Magnesium is good because it helps with muscle fatigue, it helps with muscle tremors, it helps restless legs, it helps muscle cramps, it helps with the burning in legs if you're having to walk an awful lot with fibromyalgia. Magnesium is great. When you couple that with a particular type of salt, there's many different salts of different ways of taking magnesium, but the one I use with fibromyalgia patients is magnesium malate. We find that many systems in the body, after you have something called fibromyalgia come to affect you. See, most of the time it's been at least 8 years before somebody's been diagnosed with a fibromyalgia. They're handed from physician to physician to physician many times because the symptoms can sometimes be vague. You can't put your finger on it, but unless you're really looking for it. And when you have the systems like the Krebs cycle that helps us to give our energy is not doing as much, there's a term called adenosine triphosphate. It is the energy molecule in the body. Typically through our Krebs cycles, which are in the mitochondria in every cell in the body to help make energy, are going from maybe 36 ATPs down to like 6 or 8. It has to go to a backup system, which is an anaerobic or without oxygen system to help give you energy. When you do that, you start making more and more lactic acid. Lactic acid increases like when you lift weights or you go running for miles and miles and miles. You build up the lactic acid in our bodies. When we're younger, that's what you got sore from. You have fibromyalgia, you have a buildup of lactic acid around these certain points that I talked about in the body. And the magnesium malate, taken as a usual dose of 1-3 times a day with meals, helps to dissolve this lactic acid. And over a 2 to 3 month period, you'll find that it helps to ease that myalgia and the pain that you're having. Many times we find there's problems with the gut. What I'm talking about is the alimentary canal, the GI tract. And so I address that because the alimentary tract or the gut actually is the foundation of the body for many things. If we're trying to heal the body, diet is probably right at the top of my list. But if you're not able to absorb all the nutrients from everything that you're eating, what good is that going to do as you're trying to get in your recovery for back to health? So I generally use a probiotic to aid in gut health. I use a particular kind of fibers. One uses a kind for people who have, in addition to fibromyalgia, irritable bowel, ulcerative colitis, Crohn's disease, may have diverticulitis or diverticulosis. and we use specific treatments to help the lining of the gut and help the feeding of some of the fastest growing cells in the body, which reside in the gut. Also, to help this whole process of digesting food, I usually give enzymes. I use one called Similase that uses all the enzymes for digesting fats, proteins, and carbohydrates. It also uses slippery elm and marshmallow root to help calm down the gastric area and the lower intestine also. It also contains deglycerized licorice, DGL, which kind of works like Tagamet and Pepsid and helps with stomach irritation, but doesn't carry the weight of side effects as something like Tagamet and Pepsid do. Then I'll use aloe vera juice if I need to. Aloe vera juice, 99.5%. All of the alimentary canal, and like our skin, is epithelial tissue. When you've got a burn on the top of your skin, you take some of the aloe plant and squeeze some of the juice on it. It helps it to go away. What I'm trying to do is to dose the aloe vera juice, and you take a capful 3 times a day, an hour before meals or 2 hours after a meal. This helps to get gut back on track. All we're doing really are foods that help to feed the body what it needs to do. When you do that, it's amazing. 70% of the immune system resides in the gut. You find that it is the second brain in the body, and they call a brain the mainframe brain, but it helps with depression. It helps with the immune system. It helps with the digestion of the foods. It helps with the B-complex vitamins, especially when you're trying to help people with fatigue, because those are the energy vitamins. And they help in making vitamin K and many other things. Many people with fibromyalgia may have with it hypertension, diabetes mellitus, has some cardiovascular problems, and the gut helps in every single one of these. If you're trying to lose weight and don't get your gut back in shape, you're not going to be successful. So this is extremely important. The other things you'll find with fibromyalgia patients, they can't sleep well. So we've got several things. I use something called GABA Calm. GABA-aminobutyric acid. GABA is a neurotransmitter. It's an inhibitory transmitter and helps people to fall asleep. The thing is, if you give GABA orally, it's poorly absorbed and has trouble getting through a barrier to protect the brain called the blood-brain barrier. So we use precursors, about 5 or 6 ingredients, to help the body to make GABA, and that is then taken in by the body into the blood-brain barrier, and then helps to help you relax and sleep. So I also use something for energy called D-ribose. D-ribose is a precursor to ATP. I keep talking about ATP, adenosine triphosphate. It helps to give people, really pick them up and get through their day. A scoop a day of the D-ribose powder will help an awful lot. Sometimes fibromyalgia affects more systems than what I'm talking about now. When we try to talk to people about a functional medicine or a holistic approach to treating this disease, I'm trying to help heal what we may find through looking at all the medications you take, what drugs are maybe depleting some nutrients that you're badly in need of. We look at all the disease processes that you may have and try to tie in that diet, light exercise at first, and approaching these organs that we've talked about to help you feel better. They say it generally takes, for every month that you've been sick with fibromyalgia, almost it's a month for every year that you've been sick. So when I look at people, I'm trying to start with the biggest bang for the buck, which you're going to hear from me, was from the gut. Another thing we use that works very, very quick is called Fatigue HP. It's a homeopathic product. Homeopathics help to heal the body through the energies in the body. It works through our bodies, which are big batteries. And you do somewhere between 8 to 10 drops 3 times a day. I've had people tell me with fibromyalgia that they get symptom relief in that they've not received in anything else. From sleep, more energy, and less pain in less than a week. So my name's Bill Morris. I'm a pharmacist and clinical nutritionist. Give us a call and give me a chance to try to help you. Thank you very much.